without any further ado, our first session today is a nursing panel, which will explore how nurses are spearheading cannabinoid-based care. It's moderated by Mbengue, founder of EntheaCare. We also have Dr. Rachel Parmelee, instructional assistant professor of biomolecular science in the department at the University of Mississippi. Jacqueline Higgins, nurse practitioner with Plant Amplified Wellness. Ariane Williams, director of patient care services at EntheaCare. And Sammy Pyle, an RN and CEO of Nursing Nature's Way. Please join me in welcoming them to the stage. We'll get more mics.
Okay. All right. All right. Thank you. Okay, we're waiting on more mics, but we'll just pass this down the line as they get that together. All right, so we'll do introductions first. I want to know who you guys are, what you do, and one interesting fun fact about yourself. Oh, the mics are coming.
Hello, my name is Jacqueline Higgins. I am a nurse practitioner. I hold a master's in medical cannabis therapeutics. I work in men's health where I focus in primary care and hormone management. I work the endocannabinoid system and cannabinoids into my everyday practice. It's just not the Pandora's box that everybody worries about it being. I would say I love stamps. If you want to ask me about that, feel free.
Hello, can you hear me? My name's Sammy. I'm a registered nurse, and I'm also the CEO of Nursing Nature's Way. I'm an old critical care nurse, 20 plus years, turned my pain into a purpose. So I just work with patients one-on-one and then do a lot of community education. That's really my main focus is education. And one fun fact about me is I used to live a couple of islands over on St. Thomas for many years as a travel nurse. So.
Hello, my name is Rachel Parmelee, and I'm an associate professor at University of Mississippi. And as I think Ben said, biomolecular sciences. And I create college courses at the graduate level about medical cannabis, or right now I'm focused more on the science aspect. And I guess a fun fact about me is I am an Audible, I listen to Audibles all the time. So I've listened to probably over 650 in the past couple of years, and most of those are sci-fi or fantasy.
My name is Ariane Williams, and I work with Megan at EntheaCare as the Director of Patient Care Services, where I help build out educational programs, and I support clients with cannabis and psychedelics. A fun fact about me is that I practice folk healing, and some people call me a witch.
I'm Megan, founder of EntheaCare, and where we empower healing with cannabis and psychedelics. And interesting fact about me, my first degree was a dance degree, and I used to be a professional ballroom dancer way back. All right, so now let's get into cannabis nursing. And I think that we each had our own idea of what cannabis nursing would be, and then we got into the field, and it turned out to be something completely different. Because there's, with federal scheduling and, a bootstrapped or cash-strapped industry that the cannabis industry is, there's not really a space for us in either industry right now. So let's talk about what you thought cannabis nursing was going to be versus what it is that you are doing now.
You want to start with me? That's fair. Okay, so it was 2014, if we could do a noir thing here. And the state I lived in, Minnesota, had legalized medical cannabis. And I worked in high-impact chronic pain at that point in time in my career. And patients were very interested, and I was very uninterested in working with cannabis. I was worried that I was already dealing with Schedule IIs. I didn't want to deal with a Schedule I. I think that makes sense for a lot of people. I was blessed to work with people who would allow me to walk alongside with patients and with cannabis. So truly, my initial was very like, I really want nothing to do with this. Of course, cannabis displays itself, and it's this very patient plant that just sits in the corner and says, I'll just wait for you, honey. So essentially what happened is patients were doing fabulous. And I was like, what have I learned that this is working so well? And these people are amazing. They're going back to work. I had very weird conversations about what happens if I can't work even though I'm on cannabis. What happens if my employer finds out that I'm on cannabis? There were so many questions that I had no answers to. People who were feeling so much better that they decided to go back and would go on family vacations. And I was like, please don't take cannabis to Canada, to Niagara Falls, because that could be an international drug trafficking charge, and I really don't want to be associated with that. So really, there were like very interesting conversations that happened along the way for me. And now I just feel like it should be in practice everywhere all the time. It should never be off limits, and that there's this true opportunity to, I think as medical professionals, reconnect with patients on a very different level. There's this opportunity to learn from our patients, because let me tell you, people brought me in books and they brought me in articles, and they brought me in products, so many products. So it was just this wonderful thing. And I think the other part of this is that I don't even know where I'm going in the future. I'm really just trying to embrace what comes, the opportunities, my personal passions, and then I'm honoring when those personal passions show up in other people's spaces, and I'm like, you did it, great job. Because I think the thing I really wanted when I focused on that master's degree was to have something that allowed people to believe I was accessible and had done the work to bring cannabis into the medical space in an honorable fashion. And they weren't just thrust in the way I was kind of thrust in with like, oh my gosh, there's no education. The education I got back in 2014 was weird. It was weird, okay? Like, it was just weird. It was very weird. So that's kind of where those are my thoughts about where I've been, where I'm at, and where I'm going.
What I thought I would do, so just a little background. I've been a critical care nurse, like I said, for 20 plus years, and how I really got into cannabis was I was a frontline healthcare worker during COVID. I worked on the front lines all over the country in ICUs. After about a year and a half of that, I was diagnosed with PTSD, survivor's guilt, all the things. And instead of the 5 pharmaceuticals that the doctor wanted to give me, I turned to medical cannabis instead. And what I have learned is that so many other people need help also, including our profession. There's a lot of us that are drowning in guilt and all of the effects of COVID, and we need a medicine that provides us progress through our trauma, not just mask our trauma. So what I thought I was going to do was just do some cannabis care plans here and there. As I dove deeper into education, just educating myself through Pacific College and all the different multiple organizations, there's no way I can not turn around and help what I've learned. There's no way I can hold on to that. I need to share that and spread that. So, so many doors have opened up, like you were saying. Once you dive in, there's so many doors that have opened up. I belong to different organizations in the state of Missouri. I've created a quick guide to medical cannabis. It's super quick and easy. This education doesn't have to be hard or expensive, but I work with patients one-on-one, and education, community education's my jam. I live in a state where we are completely legal. What I've learned is that people are coming forward and they want to know about this medicine. So no better person than to spread the knowledge other than a nurse. So here we are.
So what I started off doing was I was a spinal cord injury nurse in downtown Detroit for about 10 years before I even considered going back to school. So back then, so in Michigan, I became a nurse in 2008, and that was when our medical laws started in Michigan. So we would have patients ask, and really all I thought was that I was just gonna go get some more education to help the patients. It seemed to work with spinal cord injury patients, so it was interesting to me. because they were on a ton of, pharmaceuticals, and they just still were not getting relief. So as a nurse, you're just kind of like, whatever helps, right? So at that point, I never thought I would be, I guess, a professor at a university. And I started just going to conferences. I volunteered at ACNA in 2014 or 15. And then that led to me being the president of that organization. And then I continued to go through school, and I started working at Pacific College, and one thing led to another. And here I am now working at Ole Miss, where cannabis has been researched since the 60s, and I got to tour the Waller lab and look at all the grows there. And it was really interesting because I wasn't sure how I felt about working at Ole Miss because of all the things that I had heard about, their cannabis and the NIDA, the quality. But once you talk to them and understand the process, you realize exactly why that had to happen. And so that I never thought I would be in that position and do what I do today. So that's it.
Yeah, so I've been a nurse for over 17 years, and my background is also in critical care. And I moved into doing cannabis nursing back in 2020 to support my dad to come off of opioids. And when I went into it, I really thought that I was just going to be doing a bunch of cannabis education on dosing and different varieties and terpenes and stuff like that. Then I learned about the endocannabinoid system and realized that it's a lot more than just the plant, and it's understanding how to take care of the whole person and understanding different modalities that actually can support the whole person outside of just working with the plant. And then even evolving past that, now I help people quit. And that was something that I never imagined that I would be doing going into it, was talking about the shadow side or witnessing the hardships that people have with cannabis addiction and CHS, and essentially being exploited by the cannabis industry and being they just don't know, right? So that's where I am now, and I never, ever thought when I went into this that I was actually going to be helping people support themselves, witness them in their process of disconnecting from a plant that they love, that they thought was helping them always, that ended up hurting them. So it's been an interesting journey for me.
Yeah. Thank you so much for that point. And I think that's such an important point because we as nurses, we have this we are, again, uniquely positioned to both help patients discover cannabis and then help them quit cannabis. And what we have seen in the last couple of years is this pendulum go from prohibition to glorifying the overconsumption of THC, especially in adolescents and young adults. And that's harming people. We are seeing worsening outcomes. We're seeing addiction. We're seeing CHS. So nurses have this unique role to be able to bring the pendulum back to the middle, to moderation. And both in the acute phase, when bud tenders are recommending high doses for patients, and then in the chronic long-term phase too. So let's hear some stories or anecdotes on how nurses play a role in bringing people back to the middle.
Yeah, I'm going to go ahead and jump back in on that. The thing is that there is a difference between medical and recreational use. Medical is something that is, I think that recreational can be intentional, but I think the rec market doesn't understand intention, but there's an opportunity for education for conscious use and intentional use so that there can be a better understanding, but there's a difference between medical and recreational. And as nurses, we are a trusted profession, and it is our due diligence to show up in integrity and share this education on the difference between what it looks like to treat your anxiety, to treat your pain, to treat your MS or whatever it is, with doses that are appropriate, which is the lowest effective dose, not taking high amounts, right? And so for me, it really bothers me when I'm on social media and I'm seeing nurses taking dabs and promoting concentrates, because it's harmful. It's especially when there's not education involved, because Megan and I both have people who are coming to us that are CHS, or their anxiety is just out the roof, right? Or they now have insomnia, and what was once working is no longer working. And these people would identify themselves as medical patients, right? Whether it is self-management or not, they identify as medical patients. And like I said, you know, for me, when I'm seeing a nurse taking a dab, or I'm hearing a nurse that is promoting using a vape pen to a woman that's pregnant, it's incredibly disturbing. It's incredibly harmful. And I think that within the market, there has been this promotion that more is better, and more is not better. Better is better. Better can look like small doses. So it's really important for us to stand up in integrity. It's not like that we can't use it recreationally or whatever, but we have to be very, very careful the way that we promote this if we're going to promote it as medicine and medical professionals. And I can also appreciate that nobody wants to talk about the dark side, the shadow side, and the risks that's involved, because we all want to see full legalization of this plant. We want to be the advocates for it. But for me and my reality, it is grossly irresponsible for a nurse to do these things without taking responsibility for what could happen to the patient's experience on the other side. It's irresponsible for us to not know how to actually take care of these people whenever they are overusing, whenever they are starting to get sick, and we're not promoting the education. You know, there are pros and cons to it. We should be considering talking about CHS. I just had a conversation with an 18-year-old the other day whose mom was concerned about his use patterns. I talked to him about it. I talked to him about dependency. I talked to him about CHS. He's using self-medicating for anxiety. And I said, all right, so, you know, this is what it looks like, right? Lowest effective dose. And if you notice that your anxiety is not getting better, cannabis could be the problem. And this is when you need to step back, because there is this pendulum swing, and there is this this very special dose for each person, and knowing the nuance of it, right? And, you know, like Dr. Sulak said yesterday, building a relationship and having respect for this plant, because we have sat here for so long saying it's safe, it's just a plant, but it's not the same plant that's been around forever. And I do agree that this plant has evolved with us, but because of human nature, we have created it where it has evolved past us, and our system can no longer handle it. So we need to dial it back. We need to come back into a respectful relationship with this medicine, with this plant, especially if we're going to start calling it, continue to promote it as medicine. It needs to be treated as such.
I want to bounce in on that, because I think you've made so many amazing and wonderful points. There is a mantra out there that people who I wholeheartedly respect use, and I respectfully disagree. So we're going to put that out there, and that is that all use is medical use. I do not agree with this. I think that medical use tends to be focused on the lowest dose that promotes thriving, that addresses and considers, that people have to go to work, that they need to take care of their children, they need to drive vehicles, they need to get to the post office, remind me about the stamps. So there's all those things, right? So the objective always in medicine is that people are functional. That's our objective. And that's not to say that elevation at different times doesn't have some sort of therapeutic benefit. I would never say that it does not. I just think that there's this mantra we have to be cautious with. And so I do respectfully disagree with folks who are making that statement. And the other thing I think happens, and Ariane, I think that you speak to this, is that there's this resistance to pharmaceuticals and this resistance to medication, and there's this true goal to move in the direction of more holistic health, right? So people want plant medicine, but truth be told, people need movement, and they need nutrition, and they need to focus on joy, and they need to not be in employment situations that they hate. Like there's these other parts that are really about whole health and just being a whole human being that are kind of being lost in translation. And so we're really turning cannabis, this plant medicine, into just a simple pharmaceutical, right? Detaching from ownership, detaching from our body, or remaining detached from ownership of our body and our experiences. So then what you have is this careful navigation of working with what's happening with patient resistance. And I think those are the pieces that I'm also seeing, and I'm kind of hearing that in the conversation that you so eloquently discussed. Thanks, Ariane.
I just want to chime in here real quick. So working at the School of Pharmacy, and then my origins coming from more of the plant-based, I think what's going on now is that people do not have the relationship with the plant to treat it as a plant medicine. I think that a lot of people see it, it's just, they say it's a plant medicine, it's natural, but it's a pharmaceutical to them if they're just taking it, right? Like they aren't listening to their whole body, they're not paying attention, they're not journaling, they're not doing the things that help them understand how it's reacting within their body. They're not listening to their body. I think we're treating it again like just take a pill, get back to work, continue on with life. And that's just so wrong. Like it's so different than that. And I think that's one of the hardest things as a nurse is to teach patients to really listen to their body and to take notes and really tune in rather than just taking things to hopefully make them feel better. Because just like pharmaceuticals, there's always a reason for the reach for the drug or the medicine or something. And really, cannabis can be used as a masking agent as well. Just, a little bit makes me feel better. I'm gonna take more of that because I still feel better. And then they continue to reach for that instead of getting this whole broad range of different modalities that helps heal from within. They're just using that again as I don't wanna say a crutch, but as a mask of some sort. So we have to also be careful with that too.
I'm going to chime in on this one too. When I work with patients, I really try to improvise that cannabis is really giving you the power back over your health. That you now have control. You really get to listen to your body. I want you to pay attention to all of those things. And it is such a holistic thing, like the ladies are saying. And I feel like that all gets lost really in the healthcare system when you're in the hospital. It's take the pill, it's take the IV medication, and you forget all of the things that they're talking about. And cannabis really gives you that power back. So I really try to empower my patients that you get to actually listen to your body now and make all the decisions. So routes of administration, that all comes into play, that those are really powerful elements that come to cannabis. So it really is a holistic, which is a journey that I've had to learn on my own, that it is a holistic, and you really do need to listen to your body, and that's a really powerful thing. So I try to really empower the patients. So,
can I bounce in on one more thing? I'm so sorry. I think when I look at somebody who has an elevated hemoglobin A1C, right? So we're in this kind of pre-diabetes phase, and I say things to them like, I really want to talk to you about like food and how to work with food, and like let's not immediately jump to metformin. I get resistance, but it's interesting when I come at people from an endocannabinoid system perspective that there is a little bit less resistance. So.
Okay, thank you guys. All right, so let's pivot now to the unique challenges that cannabis nurses face. I think on the outside, people looking in, people just think that we're like getting high with our patients, which is obviously not what we're doing. So let's talk about our challenges that we face. Who wants to go first?
some of the challenges just being a nurse is just being able to say, I'm a cannabis nurse. Right? It's taboo. We don't talk about it in the hospital. So to even be able to say that, I'm lucky. Along with my practice, I also still work in a pre-surgical area at a level 1 trauma center. So we see lots of patients, and I have a lead way in to be able to talk to the patients. Every single surgery patient I see, I'm able to talk to them. So I think one of the biggest challenges is us just getting over the hump of being able to talk openly. I'm not going to lose my nursing license. You know, if I'm educating on a medication, it's no different than what I was taught in nursing school to do. You know, I'm now required to know about the endocannabinoid system. So I think one of the biggest challenges is just confidence in myself, confidence in the other nurses that we can talk about this and not lose our license. So just having the conversations, that's the biggest challenge that I see. Once we start talking and we're open about it, that opens so many more doors. So really just a confidence is the challenge that I see probably the most.
I would like to say too, as a nurse educator, I think, so I recently did this phenomenology study, and I talked to nurse educators across the US at universities and talked about how, you know, what was their experience with cannabis education. And out of all of them, there was one that actually threaded cannabis concepts throughout the curriculum. And I think one of the biggest challenges with teaching nurses medical cannabis is that they just think it's one lecture, right? The nurse educators think there's one lecture, or maybe it fits into this one class, but I challenge you to try to think of a class that cannabis does not fit in for nursing education. And threading it through the concepts, it's a great case, you know, study for a lot of these different topics for nurses to really grasp these concepts. And trying to share that with other nurse educators is really difficult, because you get hit with a brick wall because it's illegal, we can't talk about that. You know, so then it takes a lot of time and effort to try to, you know, talk to other nurse educators, which is, again, it's always this lack of education across the board. So trying to get this across, you know, when I first started out, I thought, I'm gonna teach patients, then I realized, well, that's not big enough because I'm not getting anywhere, okay, then I'm gonna teach the nurses, I'm gonna go to conferences, I'm gonna talk, that's still not big enough. Okay, so now let me talk to the administrators in the nursing programs, and they're still not getting it. So that's what sort of pushed me over into the biomolecular sciences at School of Pharmacies, because I can actually dedicate a whole, you know, graduate degree program to this, and not just try to put in a lecture here and there or be a guest speaker for this, because it's really ingrained throughout all of nursing. So I think that's a huge challenge to get through.
Yeah, one of the challenges that I see being in Texas is having legislators writing laws and regulations that have zero understanding about what this means to use it as a medicine and how it supports the body. When I was working hospice and I would do education on cannabis and stuff like that, even in Texas, like there was one of my patients, she really needed some additional pain management, and I was like, okay, well, you know, you take morphine and things like that. Like, what if we added in some CBD? Because, you know, in Texas, like the medical program is actually subpar, and it is incredibly expensive to do it. This family was low income, they didn't have it, but it was like, okay, like I know some really amazing trusted brands, and this was before I was working with Megan. So, but like I've done my vetting, I know the things, and I was like, we'll get you set up. I talked to the family was totally on board, and then the facility wouldn't allow her to, like, you know, for them to put it on her MAR, or for her to have it there, and she was gonna have to self-medicate and do it herself. And for hospice patients or people who are in these assisted living facilities, people with dementia and stuff like that, that can't do this for themselves, right? There's this barrier to care and comfort, and these people have a right to die with dignity. And we have all of these unfortunate laws and regulations written by people who have a disconnection from humanity and what it means for people to actually receive care in ways that can support their healing, but also support their dying process. So that's been one of the biggest challenges that I've seen that's been incredibly frustrating.
I'm sorry, I turned it off. I meant to turn it on. I actually, so I have my own thing, but I kind of want to address a couple of things that you guys have talked about. So you really talked about kind of bedside nursing. There is fascinating research out there about the endocannabinoids themselves and like critical care and mechanically ventilated patients, and how crucial this really having an awareness at the bedside for bedside nurses is. I had this wonderful experience working with some critical care nurses who had requested education. And so, it was just this fascinating space to be in, and I was so excited to be there with them. And then when we were talking about, lacing education, with cannabis, my frustration is that the heart isn't illegal, right? The lungs are not illegal. Why is the endocannabinoid system illegal? Like, how is it that we've gotten so detached? And so there was that whole thing. And I also share your frustration with legislation really being implemented in a fashion that is not supportive, and that we're working with patients who can't care for themselves, and we're a little bit restricted. I can recall finally being able to get an MS patient who was living in an assisted living access to medical cannabis, and had to beg the dispensary to find something that person could manage independently, since I couldn't get neurology to give her Ampera because that's a walking drug and not a drug for dexterity, although I don't know, it doesn't stay restricted to the legs. And I couldn't get, we didn't really have the manufactured products for those patients with these true mobility issues available. Like, we need something where maybe somebody comes in and changes a patch twice a week. Like, we need better technology and more options for patients beyond what we're actually seeing. So that would be my other thing. I just really feel like my battleground often is dosing. That's what I tend to see in practice, is that this option of, and thank you guys, you had so many great points, and I just wanted to bounce in on those. So the thing that has frustrated me the most is that really, and I alluded to this yesterday, that really well-meaning people are really giving very high dose recommendations. I went into, and I'm just going to give a little anecdote. I went into a dispensary. I was with my father-in-law. He kept us up all night due to some significant pain that was untreated following a knee surgery. And knee surgeries are pretty uncomfortable, right? So knee replacements. And so I said, I have this old farmer who has never used cannabis in his life. I just need something with a light dose. And they gave me RSO. And I said, no, that's not going to work. Like, that was not going to work. I mean, he needed 2 milligrams. 2 milligrams helped him sleep. We started at 1 milligram because he was terrified I was going to get him high. But, so 2 milligrams and he was sleeping. He was more comfortable. He was more engaged. So I think this dosing thing, if we could get folks to all be on the same page that lower doses would be supportive. I mean, it's very difficult to get a flower that's less than, 20%. And people don't need 20% to start with.
And just one more thing that I find challenging is how we speak about cannabis with my patients. I work with a lot of patients, and they say, I go to my doctor, I encourage them to have a relationship with their doctor and be honest about their cannabis use, and they say, my doctor was absolutely against it. And I'm like, well, how did you talk to your doctor? Am I losing it? How did you talk to your doctor? Did you go in and say, the blunt and it helped my anxiety? Or did you go in and say, I used my medical cannabis? I use my medical cannabis to help with my anxiety. So I feel like how you approach it, how you speak about the plant is huge. A lot of times I do classes, and one of the first things that I love to do is we're gonna break 2 stigmas. One of them is we're gonna start using the word cannabis from here on out. We're not gonna call it weed, Mary Jane. Those are all slang terms. So let's address the plant for exactly what it is, which is the scientific name of cannabis. So, and then the second thing that I do in my classes is on the count of 3, I want everybody to say cannabis loud and proud, because people need permission to even talk about it, is what I found. So once we do those 2 things, we're just breaking 2 stigmas. It's the easiest thing, but it makes a huge impact. So when we start addressing the medicine medicine as cannabis instead of Mary Jane and marijuana. Don't talk to your doctor about that. Talk to your doctor professionally about what you have going on and what you're using to treat your medicine. It's made a huge impact, and I've had a lot of patients come back and tell me, oh, my doctor actually was very receptive once I changed my language. So that's another challenge.
Okay, awesome, thank you. I want to leave time for some Q&A, so we'll jump to the last section. So if everybody wants to give one tip for cannabis nurses, either in the space or entering the space, one piece of advice, go for it.
I would say know your role, know your space, get the depth, and stay in your space.
Hello? I would say don't stop. If you have a desire on your heart to move this forward and move this movement forward, don't stop. Your family and your friends are going to be the first people that don't believe in you and don't get on the bandwagon that you're on. Only you know the desire in your heart. Only you know. So don't stop. Don't listen to anybody. Put those blinders up and keep doing you and move this movement forward.
I would say be open to what presents itself, but also hold on to what brought you to the space in the first place. I think my first relationship with this was with my grandfather, and seeing that whole situation pan out the way it did. I won't say it's a miracle drug or anything like that, but it happened to work in this situation. And as he's on his last few days, thanking me, and I me being like, no, this was you being open to what presented itself, and that stuck with me, and is what kept me going throughout this whole thing, because you will get doors shut in your face, you will be looked at strangely. I mean, it's not, I don't think it's so much right now nowadays, but it was very much early on in like 2014 time. Nobody wanted to hear you say cannabis out loud. So just be open to what presents itself, even if you imagined yourself doing this in a certain way. Like I wanted to teach, and I'm definitely doing that, but in a much different space. And do that.
Yeah, my biggest tip is to remember that the endocannabinoid system is holistic care. Like, I don't identify myself as a cannabis nurse, I identify myself as a holistic nurse. I work with multiple modalities. When I support people, it's so much more than just cannabis. And make sure that you're doing full, thorough assessments on the people that you're working with, so that if there is something that's going on, like a histamine intolerance issue or hormone imbalance, then you can help them be an advocate for their medical care within the system. So not only are you educating on the ECS, your holistic modalities, but you're still a medical advocate. So my invitation and tip is to make sure you're well-rounded and don't come at this with just being like, I'm a cannabis nurse and this is all I do, right? Because then you're gonna cut your own feet out from underneath you. Make yourself available for something bigger.
Okay, thank you guys. I guess advice that I would give is that cannabis nursing, holistic nursing is a calling. Right now, there's not a set place for us in the cannabis industry or the healthcare industry. So if we like making that bedside money, then maybe staying at the bedside is where we need to be, because that money, like for us anyways, is not there yet. Hopefully in the future. And then the other thing is that I think our greatest impact is not inside the cannabis industry. Our greatest impact is bringing people into the cannabis industry, going outside of where we're at. For example, I will go give lectures at senior living homes. We'll go table at yoga expos, at disability expos, outside of where we're at, because in the cannabis industry here, we're all one big echo chamber, right? But we need to help people outside the industry, show them the magic of the plant. We are the most trusted profession in the country for a couple of decades now. So it's we have this unique role to bring people in and show them how to use this plant intentionally. Okay, any final thoughts? All right, we can open up for questions if people would like. Ben needs a mic.
Good morning, everyone. Thank you all for your very insightful discussions. I always learn something from you guys every time I interact, so thank you so much. One of the things I want to talk about is how do we both promote cannabis as medicine without disenfranchising this legacy market or culture that's been consuming in the ways in which they've been consuming for years? How do we keep them as allies and not be like, you're not using cannabis correctly?
I get that quite a bit. One of the things that I see quite often is, I used to use cannabis in the 60s. What can you possibly teach me about this medicine? I've smoked the best. You know, it turns out we've advanced. We've come a long way. So I think for me, it's really working with those patients and breaking down microdosing and breaking down the education and breaking down that, hey, back in the 60s, did you know you had an endocannabinoid system? Along with your respiratory, along with all these other systems, did you know all of those things? So I think for me, it's to take those patients on and then start from the beginning, start from the basics, very quick. It doesn't have to be this big giant education. They need to be educated. So that's where I'm at.
Yeah, I mean, I agree. I think a big part of it does come down to education and curiosity, right? Because like when I have family members who are like, I want you to talk to my family because I think that they're addicted or that they have problematic use, right? My first thing is like, okay, I appreciate that, right? Let me talk to your family member. Let me see how they feel about it, right? Is this something, because I believe it can be something that is self-identified, because I don't live in that person's reality, and I'm not gonna tell someone that their use is not supporting them if they feel like it's supporting them, right? But I am gonna ask questions around like the mind, body, spirit, the intentionality of it. Like, how are you actually feeling every day, right? Is your cannabis actually helping your anxiety? Truly, where are you at? Like, how are you in the morning, right? Are you nauseated? Like, asking these questions. How frequently are you using? How much are you spending? Is this medicine helping you thrive, right? And none of that is to demonize or tell someone that they're doing it wrong. It's a curiosity so that people can like start having a little bit more cognitive flexibility, because the thought process within the cannabis culture is very rigid. They don't want to be told that they're doing something wrong. I'm not going to tell you that you're doing something wrong, but I am going to ask questions that are going to open cognitive flexibility so you can do a little bit more self-assessment and make a choice or decision on your own while doing education on the harms of some of these things as far as what we're seeing. Right? I mean, because let's be real, y'all. When I come in and I start talking about conscious cannabis use and intentional use, people start shifting. They're getting real uncomfortable. All these things. And like, if you have shame over your medicine, is it really helping you? If you have shame over the way that you're using, can you really show up and be a powerful advocate for your medicine? I think it's debatable.
I want to tackle this from two perspectives. One is the patient. So I love that you asked the question. I invite education. So I will refer people to the Canigma. I refer people to Healer because I think they have great education. I refer people to Trusted Canna Nurse. You have to let me know when that changes. I invite people to maybe source education from different places. And then the second is when I'm talking to industry, so local industry, right, we have some accessibility there. I ask them if they're willing to consider lower doses. Are you willing to have seeds that are 1-to-1? Are you willing to get a higher CBD or CBG dominant seed? And I often hear they can't get it. It's very interesting what I'm hearing. I will request, is there a way to have a little lower percentage in the flowers, that kind of thing. So I'm actually trying to engage industry also, because part of it is like, if nobody's ever used, think about like being that high. That would be awful. Like you'd turn people off permanently. So that's how I approach it.
I think your question is bigger than cannabis. I think if you approach anybody with you need to do this and you need to do that and trying to force feed information, they're going to close off, because that closes off, because they are going to question, that makes them question everything that they believe in, right? Well, what else was I wrong about? And that's very difficult for anybody to swallow, right? Like you just don't approach people in that manner. And I think just asking questions and waiting for them to be open and start asking you questions. And I think that's probably where I listen more rather than walk in and you're doing it wrong, or this is not right, or just, so that's really the approach that I've always taken. So.
Yes, good morning. I wanted to first of all acknowledge that the physician-nursing relationship is essential for moving forward this paradigm of healing. We clinicians cannot do it without you, and nurses all obviously need our support. And my experience, and I have my nursing person behind me, Tony Sanchez here. Tony. And Tony and I, we enjoyed working together, and I was wondering how you are seeing the use of AI as a tool to aggregate the knowledge that you start prescribing to your patients, and to do that knowledge transfer to the other clinicians who are not aware of the cannabis therapeutics that we are prescribing. I feel that this is one of the great brave new worlds that we are facing, because AI is allowing us to aggregate that knowledge, and as we all know, the hurdle of communicating with the rest of the community. What the hell are you guys doing? I think it's very paramount. And as you have said, beyond being precise with dosing, we're saying all the time, we're doing holistic. This guy has anxiety and we're giving him the right dose, but we're also teaching him mindfulness, we're teaching him cognitive behavioral therapy, and that's what the nursing physicians team. So, and any thoughts on this brave new world possibilities?
I would like to speak to that, because I think you guys remember I had them do an assignment where they inputted some information into AI to see, it was all about cannabis. So I would caution anybody using AI, and the cannabis information is really terrible. So I would have them input a question about cannabis in some sort of condition, and then they would have to go back and look everything up, read the research, and a lot of it was wrong. I mean, maybe now it is. I mean, this was a couple years ago, so it was probably not as good as it is now. But I would just caution with certain models. I mean, if you're working with a specific model that has been developed for these purposes, certainly. But just the generic AI models are terrible at cannabis advice. So I would use caution with that.
Go ahead.
One thing I do is I feed them correct information. For example, I'm using CannaKeys. You know that CannaKeys is a great cannabis aggregator. I'm a fan of them. So I understand what you're saying. We are the pilots. AI is a co-pilot, and he will hallucinate. He will say crazy stuff. But if we have a good database, and he hears us out, and we tell him, you have to respond to what I have given you. I think that helps us avoid the hallucination and what the hell did you just said.
I'm going to just say that I would agree with what you just said, which is that the quality of the AI content that is coming out is really the quality of the question and the tailoring of the question that you've put in. So I would absolutely agree with you from that perspective. I can say that personally, I'm not using it specifically for patients. I have used it to help me, what would be a quality lecture for, different professionals I'm trying to target who have, had questions, and I use it as a jumping point for my personal research that I then go do, whether it's PubMed or it's CannAKeys, which is a wonderful program. I agree with you. So that's how I'm using it, but specifically with patients, I haven't actually ventured into that.
One thing that I have ran into with patients that go down the route of using AI to do their research is the resources. The resources, once they look, I'm like, hey, if you dive down that rabbit hole, make sure you check those resources. And the resources aren't coming up valid. Yes, AI will give you a resource, but did you look at that resource? Because it's not valid. So yeah, they gave you some mumbo jumbo stuff, but it's really not valid. So always turning to the different resources and ease up on AI. So it's definitely been a challenge for sure.
And there was a nurse who was supposed to be here who has patented AI technology, and she was going to be here to speak about that. But yes, it can be a tool. All right, we have time for... No, we're done? Okay, cut off. All right, thank you.
All right. Thank you so much to to all of our panelists. We're going to do a quick stage switchover to get ready for the practicum. So just give us about 5 minutes and we'll get started with that. While we do that, another reminder, if you are looking for CME credits, make sure you register with Horizon CME. You should have it in your email. If you don't and you're interested in CMEs, again, there's some slips up here with the QR code. Scan it, get registered, and get your credits. So, like I said, 5 minutes, and we'll get started.